slide here is just a disclaimer, basically saying that I'm not an attorney. I'm an insurance agent. So I am not affiliated with the federal government. I am strictly an insurance agent. All right. So this is the questions I get quite often is I'm turning 65. What do I really need to do? I have no idea what to do. All I know is I'm bombarded with emails. I'm bombarded with mail, and I just really don't know what to do. Do I need to sign up for Part A and Part B? Well, that's a good question because it really depends on so many different factors. Are you going to stay on your employer plan? If you do stay on your employer plan, do you have a spouse on the plan that's maybe over 65 or under 65? Where you work, is it a large group? Is it over 20 people? Is it under 20 people? All of those are the questions that we really need to get answers to in order for us to advise you the correct way. Now, if you decide you're going to stay on your employer plan, probably one of the most important things about this is making sure that the plan that you have through your work is creditable to Medicare. So basically what creditable means is if you say, oh, I'm going to work until I'm 70, I'm going to stay on my employer plan, you have to go to your insurance company or your HR and find out if this plan is creditable to Medicare. We want to make sure that the prescription piece of this plan is as good or better than a Medicare plan. Because what will happen is, let's say you wait till you're 70 years old, you finally decide to go on a Medicare plan, and Medicare goes out to verify that you've been on a creditable plan, and boom, we find out that you've not been on a creditable plan. And what happens is you're penalized for every single month that you are not on a creditable plan. And surprisingly enough, I have clients that say to me, well, I thought my work insurance was good. I just stayed with what I had. And then they come to me at 60 or 70 years old or so when they retire, and we find out it was non-creditable. So it's extremely important. Now, every insurance company, whether it be Anthem, Aetna, MedMutual, United Healthcare, every insurance company has like a form letter that you can go to that insurance company and say, I want proof that if you're staying on your plan, that it's creditable or non-creditable. Now, here's the other thing is it could be creditable this year, but change next year. So as many of you are aware, a lot of times your plans change like every January. So you get a new plan every January. So we could find out today that it's creditable, but then whatever plan that you go to next year may be considered non-creditable. So if you are over 65 on an employer plan, you continually every single year want to make sure that your plan is creditable and keep that letter, because here's the situation. Let's say when you come off the employer plan at 70 and we have to go out and buy a Medicare plan, then sometimes if the government, Medicare is trying to give you a late enrollment penalty, we have to go or show proof that you've had that coverage. So that's a very important piece of this. Another question I get is, how do I enroll in Medicare? Because my neighbor was automatically enrolled, but I haven't received anything. Well, the way it works is if you're currently receiving Social Security benefits, and many of you know that you can receive Social Security benefits at 62. If you're receiving Social Security benefits, then you're auto-enrolled into Medicare. So about 3 months before your 65th birthday, you receive your Medicare card in the mail. If you're not drawing Social Security, then you would have to enroll into Medicare physically, either talk to Social Security or go out to medicare.gov and enroll in Medicare if this is the route you're taking. Now, I will tell you, with all of the junk mail that you're getting, if you're already receiving Social Security benefits and you receive your Medicare card in the mail automatically, please watch for that card, because it comes in an envelope mixed with all your other junk mail, and sometimes it gets thrown away. So just remember to watch for that and don't throw it away, because we need it. The other thing about your Medicare card is it is a paper card, kind of like your Social Security card, and you are not supposed to laminate it. So I think pretty much everybody that I sent a book to, I sent a Medicare card protector. So if you have that Medicare card already, or if you're going to be getting it here in the future, then it has a plastic protector that I put in that booklet for you. All right. What do I do if I'm still working, but I'm turning 65? Well, here's what we need to do. We need to have a conversation. So basically what I do is when someone calls me and says, hey, I'm turning 65, I need to know what the process is. Should I stay on my employer plan? Should I come off my employer plan? I'm getting all these mailings. I'm getting all these emails and phone calls. I just need to know what to do. I always recommend us having a conversation. So when I have a conversation with you, I ask you the questions, what size employer plan do you have? Do you have a small employer or large employer? We verify, because I talked to somebody yesterday, they have a 24-year-old child on their plan, which basically means if the person turning 65 comes off the plan, that 24-year-old daughter loses her insurance. He also had a 63-year-old spouse. She would have lost her coverage. So we would have to make sure that we don't make any errors in making sure that we do the right things for you, because there are some things that if we don't do on the right timing, you are penalized for lifelong penalties. So I do like to at least have a conversation to make sure that we have all the facts and we go through and make sure that we're doing with you exactly what we should do. Now, here's another one that I get a lot of questions about. A lot of people's employer plans have an HSA attached to it. An HSA is considered a health savings account. Now, a lot of people, contribute their max to that HSA. One thing I want to make sure you understand, if you enroll in any portion of Medicare, even the Part A, that's the zero cost, you can no longer contribute to that HSA. I'll repeat that one more time, because I have several people that keep contributing and they go out and enroll in the free part of Medicare, the Part A, doesn't cost anything, and they keep contributing to the HSA. If you are enrolled in any portion of Medicare, you cannot contribute to an HSA. So basically, if you was to ever get audited, you would have to, go back and pay taxes on all that. So we definitely want to stop that. Another thing I find is, sometimes people wait till they're 66 and a half or 67 and start drawing Social Security, but still continue to work. If you draw Social Security, you're automatically enrolled into Part A, which means, once again, you cannot contribute to that HSA. And I've seen people, I've met people that they didn't really know. They're coming to me at 70 years old when they finally retire. They've been drawing Social Security for a couple of years, and they've been contributing to that HSA for a couple of years. So we've got to be really, really careful. As soon as you enroll in any portion of Medicare, you can no longer contribute to that HSA account. All right. So here's the first questions. What is Medicare? Well, here's how Medicare works. Medicare is broken into several different parts. Part A of Medicare and Part B of Medicare are the two that is provided by the federal government. Part A of Medicare covers a portion of all of your inpatient care. That would be inpatient hospitalization, going into a skilled facility after a hospital stay. And Part A covers just a portion. It does not cover 100%, just a portion. Okay. Now, Part A generally doesn't cost anything as long as you have worked over 40 quarters. So as long as you worked over 40 quarters, Part A, there's really no cost to it. Part B of Medicare covers all of your outpatient services. Well, it doesn't cover all of it. It covers a portion of it, but it covers the outpatient services, such as like doctor visits, x-rays, CAT scans, MRIs, ambulance, physical therapy, let's just say chemotherapy, things like that. Anything that's outpatient is what Part B covers. Okay. Now, Part B does have a monthly cost. So for 2021, The standard monthly cost is $148.50, $148.50. That is the standard rate for Part B. Now, with that being said, here's when you enroll in the Part B, here's what happens is Social Security goes out and they pull your income tax return. So the way it works is Social Security always pulls your tax return from 2 years prior. So for 2021, we're looking at your 2019 tax return. So when you enroll into Medicare Part B, Social Security pulls your income tax return. After they pull your income tax return, they send you a letter if you have made over these certain amounts. So this is pretty important here. So let's say if your yearly income in 2019 was, okay, so let's say you filed a joint return, $176,000 or less, then you pay that $148.50. Now, if you filed a joint return and your income was $176 to $222, then you're paying the $207.90. So you can see it's $148.50 plus $59.40. This $59.40 is what we call an IRMA, income related monthly adjusted amount. So you would get a letter from Social Security that says we pulled your tax return and you made, let's just say $200,000. Your Part B rate is going to be $207.90. So for my higher income folks, here's kind of what I see is the higher your income, the higher your Part B premium. So I always like to address this up front to where you know that if you have a high income, that you're definitely going to be at the high income there on the Part B. Now, another thing that I just saw, for example, I had a client and he owned his own business and she owned her own business, husband and wife. They decided to file married but a separate return. So you can see down here, if you make over 88,000 to 411,000, you're paying $475.20 for Part B. So let's say you have a husband and a wife, they each make, let's just say 100,000. They're both going to be paying $475.20 just because they filed a separate tax return. Whereas if they would have filed a joint return and they both made, let's just say 100,000 each, they would have been more like in the second category here, paying the $207.90. So make sure when you're filing your tax return that you take into consideration when you go on Medicare, what your costs are going to be. Okay. This is a little confusing, but I just want to make sure that I definitely bring it up because I have a lot of clients that fall in these higher income brackets, and this is kind of a big shock to them. Okay.
And we have a question in the chat asking if that IRMA is adjusted periodically.
The IRMA is adjusted every year, January, around the beginning of January. So in January 2022, they're going to look at your 2020 tax return. And then, of course, in 2023, your 21 tax return. So it always goes back every 2 years. Now, if you are somebody that is getting an IRMA because let's say you're employed and you make really good money and then all of a sudden you sell your practice or you decide to retire, it is super important for us to try to appeal that Part B. Okay, so here's my example. Let's say in 2019, you made $500,000. But in 2021, this year, you're going to retire. Well, let's say you retire in July. They're going to pull your 2019 return and say, well, he made $500,000 or she made $500,000. We're going to give them an income adjustment of whatever it was, up to $475. But realistically, you had a life-changing event. Let's say you're retiring. So really you made $500,000 in 2019, but your income is really drastically changing because now you're retiring. We can do an appeal through the Social Security office to show them that you had a life-changing event. Now, if you don't do that appeal or you don't initiate the appeal, Social Security does not know that you retired. So you will be paying that higher rate all of that time until finally your tax return drops back down, which could potentially take another year, year and a half, maybe 2 years. Because let's say your income changes in 2021, they're not going to pull your 2021 tax return until 2023. Does this make sense? So it is complicated, but every single year they do pull your tax return from 2 years prior. So this is pretty important, I think. So, all right. Now here's what the kind of the way that I explain Medicare Part A and Part B. I'm a very visual person. So I explain Medicare Part A and B through the government as like a piece of Swiss cheese. So when I'm looking at this piece of Swiss cheese, what do I see? I see a lot of holes. So Medicare Part A and Part B is the coverage that's provided through the government, but it has a lot of holes in it. So we're going to talk about how we would fill those holes. So realistically, when you go on Medicare, you really have a couple of options. Your first option is if you're still employed or your spouse is employed, you can go on the stay on the employer plan in some cases. So you have that option. You also have the option of going on a Medicare supplement or a Medigap plan. So many of you, I'm sure, have heard the word Medicare supplement and Medigap. Those two words mean the same thing. So they're kind of used interchangeably. But of course, sometimes it gets a little confusing because some people use Medicare supplement, some people use Medigap. Okay, we're going to talk about the way that those plans work. The other option you have is Medicare Advantage, and we'll talk about those. All right, let's talk about the Medigap plan first. So Medicare supplement, Medigap. Here's the way that these plans work. So you have your Medicare Part A and Part B through the federal government. Okay. You go in and let's say you have a CAT scan done or an MRI or just go see the doctor. Medicare pays your bill first if you was to purchase a plan like this. So you go to the doctor or the hospital, you show them your Medicare red, white, and blue card. The doctor or hospital bills Medicare. Medicare pays their portion. And then you buy a Medigap or Medicare supplement plan through a private insurance company, like an Anthem, Aetna, Humana, whatever. You buy a Medigap or Medicare supplement through a private insurance company, and then they bill that second. So you have your Medicare's billed first, and then your Medicare supplement plan is billed second. That's how Medicare supplement plans work. Now, typically, you have a wide variety of different types of plans that you can choose from, depending on what company you go with. And here are all of the plan options. And I'm sure many of you may or may not have seen this chart. This chart basically talks about the plans A through plan N that most insurance companies sell to ones turning 65 or going on Medicare. Now, if you look at this, the ones with the most check marks is the ones that have the most comprehensive coverage. So the plan we would talk about today is the plan G as in girl. So if we look at this, like I said before, your Medicare Part A and Part B is like that piece of Swiss cheese. So you have all the holes. So if you buy this plan G through whatever insurance company we would pick, if you can see here that it would fill all of the holes of the Part A. So it says Part A, coinsurance, deductibles, things like that. So the plan G would fill all of those holes in that Swiss cheese for Part A services, which is your inpatient. Okay. And it shows that it covers all of your costs. So like I said, Medicare pays their cost. Then of course you are billed. Well, this plan would pay all of your cost for everything with the exception of the Medicare Part B deductible. So you see that hole right there. That is a deductible that you would have to pay. Now that deductible for 2021 is $203. So virtually you're paying the $203 deductible. And then as long as Medicare pays their portion, then your plan G, supplement plan, is going to kick in and pay your portion. So this is one of the most comprehensive plans. Now, if you look next to this, it has the plan F. It fills that $203 deductible. Well, the plan F is no longer allowed for us to sell for people turning 65 after January 1st of 2020. So realistically, this plan G is your most comprehensive plan that is now available for us to sell to people. All right. Now, this is what I just talked about, the Medicare Supplement Plan, the G plan. What are the facts? Once again, it basically covers all of your Part A coinsurance and hospital cost. It pays the Medicare Part B cost for everything except for that $203 deductible. So once again, you have to pay that $203 deductible, and then it kicks in and pays your cost. Now, some people ask me, well, how much does this cost? Because this is super good coverage. How much is this going to cost every year? Well, the way that the insurance companies determine is they base the cost on your age, gender, demographic, and of course, what carrier do you use? So if you buy a plan G with one company, it's really the same plan G with another company because those are regulated by the state. So what I'm looking at, enrolling ones into a plan G, I look at, what's the consistency of the carrier? What's their rate history? What's their customer service like? How do they pay their claims? So we look at all different aspects when we're trying to figure out which company to enroll you with. The rates do go up annually though. So every single year, unfortunately, you're going to get a rate increase. So a supplemental plan G for a 65-year-old, let's say 65-year-old male might be, let's just say $125, for example. A female might be 110. Well, that's at 65 years old. Well, what happens when you turn 75? Is it still going to be the same cost? Absolutely not. You're going to see the rate change as you age. You will always see a rate change going up. Now, with the Medigap plans, you can choose any doctor, any hospital that takes Medicare. So what I find is, like I might have people living here in Ohio and they have a summer home or a winter home down in Florida, or they might have a winter home in Arizona or whatever. If you're somebody that wants to make sure that you have flexibility to see whatever doctors, whatever hospitals, you want more flexibility as into, you don't want to worry about, does my doctor or hospital take this plan? Medicare Supplement is probably your better route because you can go to any doctor, any hospital that takes Medicare.
Suzanne, we have a question in the chat. Is the Part B coverage $203 deductible per service, per month, or per year?
That it is an annual deductible. So it is one time per year. Now that deductible does go up every year. So like 2020, the deductible was $198. 2021, the deductible went to $203. So you can see that it does go up typically a few dollars here and there, but you're going to see it probably go up every January because Medicare dictates that deductible. We don't, the insurance companies don't, it's strictly Medicare that dictates that deductible. And we don't find out about the deductible change until somewhere around October, November, when they finally release all of that to us. That was a great question. Sorry, I didn't cover that. Okay. Now, one thing that Medicare supplements do not cover is your typical your medications. Okay. Now they do cover medications if you're like in a facility. So like, let's say you're in the hospital or you have to go into the hospital, like an outpatient to get like a treatment such as like chemotherapy or IV therapy, things like that. That all goes under the Part B of Medicare. But for your daily maintenance meds, your high blood pressure meds, your heart disease, your diabetic meds, most all of those are not covered under traditional Medicare and or your Medicare supplement. So what you need to do is you need to buy a Medicare Part D plan. D is in drugs. So since it's known as Part D, a lot of people think, well, the Part D is through the government. And once again, it's not through the government. It's through a private insurance company. It's known as Medicare Part D, but it's through a private insurance company. So typically what we do is take a look at your particular medications. Okay. So when you're turning 65 or you're going on Medicare, we take a look at your current medications. We need specific dosages. How many do you take per day? What pharmacy do you use? Typically, those are the things that we need to have to make sure we can accurately shop your plan. Okay. So let's say that you take the generic name of a medication, not the brand. I need the generic because when I'm going through and putting them into our program that goes out and shops all the prescription drug plans out there, it makes a big difference if you're taking a brand or a generic. It makes a difference if you're taking 1 pill a day or 3 pills a day. It makes a difference, believe it or not, it makes a difference on what pharmacy you use. So when we take a look at shopping your prescription plan, what we do is we look at all of those things. And sometimes I'll ask you, do you have to use CVS or do you have to use Walgreens or do you have to use Kroger? Because maybe under a specific plan we pick for you, it might be a better option for you to use a different pharmacy. Here's an example. So I had someone come in my office a while back and we were shopping his plan, and I forget exactly which pharmacy he was using, but I shopped it to another pharmacy. So it was exactly the same medication. It was exactly the same dosage. And I said, would you be interested in going from this pharmacy to this pharmacy? And believe it or not, it saved him $1,500 just changing pharmacies. We did not change drugs. We didn't change dosage. All we did was change pharmacies, because you want to make sure you're going to a pharmacy that is a preferred pharmacy on whatever plan that you go with. Okay. Now this is what we call the donut hole. So this is probably, I would say probably one of the most confusing parts to try to explain. So I try to spell it out here and give you a picture, because once again, I'm a visual person. So hopefully you guys can help understand through the visual here. So basically the way it works is every year starting January 1st, or when you first become Medicare eligible, Medicare, and you enroll in a Part D plan, Medicare starts this process. Okay. So let's say we go out, we find a drug plan for you. Your beginning part of that drug plan is what we would call the deductible phase. Most all, not all, but most all drug plans have a $445 deductible that you have to pay before the insurance kicks in. Okay. Now, not all plans, but most of them do. Okay. Now that deductible may or may not be, depending on the plan, applicable to all drugs. So sometimes I see that the generic medications, this deductible is not applied to, but most all plans, they have this deductible. Okay. So once you hit that $445 deductible, you go to what they call the initial coverage phase. Okay. Now, while you're in the initial coverage phase, the way that it works is depending on the tier of the drug. So let's say you're taking, let's say lisinopril or simvastatin. Those are your super cheap drugs that might cost really $2 or $3 or $4. Okay. So you're only going to pay $1 or $2 or $3 or $4 because it's super cheap. But let's say that you are on a insulin, a more expensive insulin, for example. In most plans, you have that $445 deductible. And then when you're into the initial coverage phase, you pay a co-insurance or copay based on the tier of the medication. So every drug has its own tier. Your tier 1 is your lowest tier, which means it's typically your cheaper. the higher the tier, the more expensive the drug, the more you pay for that drug. So let's say that you're taking a insulin, for example. Your copay or coinsurance could be $40, $45 because sometimes those insulins could be around $300 to $400 or $500 a month, depending on which brand and how often you use it. Okay. So while you're in the initial coverage phase, you are paying typically a set copay or a coinsurance. Okay. So let's use an example. Let's say that you take a drug, the total cost is $500. Let's say you go to the pharmacy and your cost is $50. You're paying $50 and the insurance company is paying $450 for a total cost of $500. Okay. Medicare gives you an allowance. This is the 2021 number. They give you, I call it like a kitty of money. They give you $41.30 in monies that can be used before you enter the donut hole. Okay. So you just went to the pharmacy, you bought that $500 drug. You paid $50. The insurance company paid $450. The total $500 comes out of this $4,130. Not the amount you paid, not the amount the insurance company paid. The total amount comes out of that. Okay. So as you can see, let's say that you take 2 medications a month that cost a total of $500. You could use this $4,130 up in a month or 2 months or 3 months, depending on your medications. I had a client that came into me a while back that was on a $10,000 chemotherapy pill, which meant he went through the deductible, into the initial coverage, and into the donut hole or coverage gap all within the 1 month. So this is how it works. They go off of the total cost of the medication. Okay. Once you've used the $4,130, you fall into what Medicare calls the donut hole or the coverage gap. This is where a lot of people get hurt because once they're into this donut hole or coverage gap, they being the client, pays 25% of the cost of that drug. So for example, that $500 drug we just talked about, remember they only paid $50. Well, now they're in the donut hole and they're paying 25% of the $500. So now they're going from paying a $50 copay to $125. See the difference? When you go into that donut hole, now your cost is definitely jumped up, especially on brand name medications. So a lot of clients come to me and say, well, Suzanne, I'm in the donut hole. It's so expensive. I can't afford it. I don't know what to do. What we do know is a lot of people, when they go in the donut hole, they start cutting their medications in half because they can't afford them, or they just quit taking them because they can't afford it. So a lot of times when I'm looking at your drug plan, if I see a really expensive medication, I'll, say, go back to your doctor and tell your doctor, now you're going on Medicare. You have the donut hole to face. Is there any alternative medication? Now, sometimes there's not, but sometimes there is an alternative medication that you could potentially go to that maybe is more of a generic or even just a cheaper brand name that'll help you through that coverage gap or that donut hole. Okay. Now, you stay in the donut hole until you have reached 65, 50 out of pocket, or January starts back over, things like that. And then you go into what they call, Then you go into what they call the catastrophic phase. Now, if you get into the catastrophic phase, this is the cheapest phase that you will ever be in because you've already paid a lot of money out of pocket. Okay. When you get to that catastrophic phase, you pay approximately 5% for that drug. So now you're paying 5% of that, my example, $500 drug. So you can see that once you hit catastrophic, it drops way back down. So this is just an idea. I kind of wanted to give you guys a synopsis, I guess, of how the Part D drug plan works. Because there is a lot of chitter chatter out there of people not understanding how it works, not knowing what they're getting into as when they turn 65. And we do go through this to make sure that everybody understands what their potential liability could be based on their meds. Now, if you're taking only, a couple of generic medications, this is probably really a moot point. But as you and I are aware, your health can change in a drop of a second and your meds could change. So I like to at least let everybody know how this works, because really almost all drug plans have this donut hole or coverage gap in it. All right, so let's go back and talk about the Medicare supplement plans. So the Medicare supplement plans, Medigap plans, remember these plans piggyback Medicare. So Medicare pays first, and then your Medigap or Medicare supplement plan pays secondary. So if you have something Medicare does not cover, then your Medicare supplement plan is not going to cover it. Here's an example. Probably 6 months ago, my dad had his cataracts removed. And when he went in to have his cataracts removed, we were told if you use these lenses, Medicare covers them. If you want to buy the upgraded lenses, Medicare does not cover them. So there are things that Medicare does not cover. Dental, vision, which would be your routine eye exams, unless you have a medical condition. Hearing. Those are three of the biggest questions I get: dental, vision, hearing. And Medicare does not cover them. So if Medicare does not cover them, then your supplement plan is not going to cover them. And of course, the prescription drug, the Part D, goes with the supplement. So when you're buying this, you're doing Medicare, your supplement, and your prescription drug Part D plan. The second option we're going to talk about is what we call Medicare Advantage plans. Now, the Advantage plans is probably the ones that you see all the ads on TV for towards the end of fourth quarter, because that's open enrollment. Medicare Advantage plans have the buy this plan for zero cost. You get free dental, free vision, free hearing, and zero cost for this plan. So let me explain to you how it works, because people will call me and say, is this really a scam? Is it real? Is it legitimate? I get so many mailings for this. I get so many phone calls about this. How does this really work? Here's the way it works. First of all, it's not a scam. You just have to understand the process. Okay. So the way Medicare Advantage plans work is you must continue to keep paying your Medicare Part A and you must continue to keep Part A and B. You must continue to keep paying your Part B. So remember, that was $148.50 unless you had higher income, then it went higher. Okay. Now the question is, how do you pay the Part B? Well, if you're drawing Social Security, it comes out of your Social Security check each month. If you're not drawing Social Security, then you're billed on a quarterly cycle from the government. Okay. All right. So here's how these plans actually work.
Suzanne, we had another question pop up in the chat related to the donut hole. Does that start over every year?
It does. It does start over every January 1st. Great question. Great question. Okay. So on the Medicare Advantage is also known as Medicare Part C. So now we've talked about Part A and Part B, that's through the government. We've talked about Part D, which is the drug plan. Now we're talking about Part C, okay, which is known as Medicare Advantage plan, okay? The way that these plans work is you pick an insurance company. So let's just pick a company. Let's use Aetna, for example. So let's say that you decide you're going to enroll in an Aetna Medicare Advantage plan. What happens is Aetna says, here, buy my plan for a zero monthly cost. For example, they have a zero plan in a lot of places. And if you go to the doctor or hospital or have a CAT scan done or an MRI or a surgery, Medicare pays Aetna and Aetna pays your benefit. Okay, I'll do it one more time. So Medicare pays Aetna and then Aetna would pay your benefit. So if you went in and had that CAT scan done or MRI or inpatient hospital care, Aetna is the one actually paying your benefit. Okay. So when you enroll in, for example, an Aetna plan, Aetna says, here, you can enroll in our plan, but here's our rules you must follow in order to get the best benefit for your plan. Okay. They typically have low monthly payments. Like I said, a lot of them are even a zero premium. Okay. It covers so much of your outpatient. It covers so much of your inpatient. And it also covers your Part D, which is your drug benefit. Okay. Now, here's the rules. To get the best coverage, as in cost wise, you need to stay with networks of providers. So if you go with the Medicare Advantage plan, you need to make sure that your provider is in the network for that particular plan in order for you to get the best rate. Okay. If you go out of network, you would, depending on the plan you pick, you could potentially have no coverage, or you could potentially have coverage and just have to pay a lot higher rate because you're out of the network. So Medicare Advantage plans have networks of providers. Okay. Now, the other thing with a Medicare Advantage plan is Medicare Advantage plans have what they call maximum out of pocket. Okay. So basically what that means is on most Medicare Advantage plans, everything you have done, I say most everything you have done, you have a set dollar copay or coinsurance that you have to pay. For example, let's say that you ended up going into the hospital on a Medicare Advantage plan and staying the night in the hospital as an inpatient. A lot of these plans, you would have to pay, let's just say $350 per night. So if you're there, let's just say 5 nights, you're at what, close to $2,000 in that ballpark. Okay. So you would have a higher out of pocket on these plans than the supplement that we talked about before. Okay. The benefit of the Medicare Advantage plans is they do have what they call a maximum out of pocket. So if, God forbid, you have a bad year, God forbid, you get cancer or you're in the hospital with heart disease or an open heart surgery or something that's hundreds of thousands of dollars, at least on the Medicare Advantage plans, they give you that maximum out of pocket that you would have to pay to basically prevent you from going bankrupt. So that is a very, very nice benefit on the Medicare Advantage, is it does give you a max out of pocket. Low premium, so a lot of times it's even a zero premium, but it's a max out of pocket of, let's just say, well, there's a range between $3,500 and $10,000 because it really depends on what plan you pick and if you stay in the network or you go out of the network. So it does give you a big range, but that's how Medicare Advantage plans work. Now, a lot of times with Medicare Advantage, since they're administered through a private insurance company, they can throw in additional items such as dental, vision, or hearing, where they give you maybe $2,000 or $3,000 for hearing aids a year, maybe a couple cleanings and a discount on your, comprehensive coverages like fillings or extractions, a discount on eyeglasses in your eye exam. So sometimes Medicare Advantage throws those additional benefits into their plan because it's administered through the insurance company, not through Medicare. So there is a difference whether you do Medicare Advantage or Medicare Supplement. Okay. Now, when I meet with you, we go through these and we figure out which one makes the most sense for you. So when I'm comparing which type of Medicare plan is really the right one for you, when I help you figure this out, here's what we come up with. There is not a right or wrong answer. What is the one that best fits your needs? Now, I need to make sure that you understand the rules. So here, when I'm talking with a client that's, just turning 65, whatever, I go through and make sure they understand the rule. Okay. The rule is, and once again, I told you I'm a visual person. So I think of a ladder. Okay. So at the top of this ladder, I would put Medicare Supplement Medigap. because you really can't get higher coverage than that. Okay. Going down the ladder, I would put Medicare Advantage, because Medicare Advantage is cheaper per month, but you are assuming a higher liability. So it's really down the ladder. So here is a rule that Medicare has. Let's say you just turned 65 and you come to me and you say, I'm super healthy. I only go to the doctor once a year just to get my scripts renewed. What do you think I should do? Well, let's make sure you understand. If you start with Medicare Advantage, so you're starting like, let's say in the middle of the ladder, you start with Medicare Advantage. And then let's say 2 or 3 years down the road or 5 years down the road, you call me and you say, oh my gosh, I just found out I have whatever, cancer or diabetes or heart disease, or I need my hip replaced, or I need my 2 knees replaced. I want to go up to a supplement. You're trying to climb the ladder to the supplement. You have to medically qualify to climb up that ladder. So one more time, if you start with Medicare Advantage and you've been on that Advantage plan for more than 12 months from your Part A date, you have to medically qualify to climb up that ladder, which basically means that the insurance company is going to go out and they're going to underwrite you. They're going to pull your medical records. They're going to check your history to see what your medical history has. And they can either deny you based on your history, or they can approve you but give you a big rate up based on your history. So some people will call me and say, well, I mean, can I start Medicare Advantage and at open enrollment each year just jump up if I want to? And the answer is no. You cannot go from a Medicare Advantage to a Medicare supplement without medically qualifying if you are over 12 months of your Part A effective date on Medicare. Now, what you can do is you can start at the top of the ladder with Medicare Supplement. And as you age and the cost goes up and you decide, I can't afford this or I don't want to pay this, you can always move down the ladder at open enrollment. So I just want to make sure that you understand this rule, because this is a lot of confusion here. All right, so when you're putting them side by side, when you're trying to figure out what's the best option for me, here's what we're looking at. Medigap, which is your Medicare Supplement, Medicare Advantage. Okay. Medigap, Medicare Advantage is basically the same thing for your Part A and B. You have to keep Part A and B. You have to keep paying the Part B premiums. Okay. Medigap, you are having Medicare pay first, and then it's forwarded to the Medicare Supplement or Medigap Plan to pay its share. Medicare Advantage, remember, it's administered by the insurance company. So Medicare itself pays none of this. Medicare has paid the Advantage company that you've picked to administer your benefits. The premiums on Medicare Supplement is typically more expensive. Now, this is a kind of a wide range because it depends on, of course, where you live and your age at time of enrolling, but anywhere between $110 and $200 a month on Medigap. Over here, a lot of plans in Central Ohio are $0. A lot of plans. So $0. Over here, the prescription plan is not included. We have to purchase that separately. On the Medicare Advantage, it is included. On the Medigap, your out-of-pocket is extremely small. Remember, like this year, if you chose that particular Plan G, it was only $203 deductible. And then, as long as it's a Medicare covered expense, it's covered 100%. Over here, you have that higher out-of-pocket. Now, I know these numbers don't match the numbers that was on the screen before because every plan is unique. So it could be $3,400, it could be $5,900, it could be $6,700. It really depends on what plan you go with. But just realize this is your liability. You have a liability. A Medigap or Medicare Supplement plan, you can go to any doctor facility that accepts Medicare. So you have a very wide network. Medicare Advantage, if you pick an HMO plan, you must choose a provider that takes that plan. If you go out of network, there's no coverage. A PPO plan, you can use any provider, but it may cost you more because you've now went out of the network. Okay, so some of you have never seen what a Medicare card looks like. So I just thought I'd drop this one here and let you guys know this is what your Medicare card looks like. Once again, it's paper and you can't laminate it, just a reminder. So this is the question I get. It's kind of awkward because people will say, I have a kind of an awkward question for you. What do you charge to do this for me? Well, how I get paid is when I enroll you with an insurance company. So I don't charge any fees for my service. Basically what my office does, my team and I, we sit and analyze what makes the most sense for you, whether it be staying on an employer plan, coming off and going on a Medicare supplement plan, doing a Medicare Advantage plan. What is the right thing for you? We will figure that out with you. We don't charge any fees for our service. So when we enroll you in the plan, we get paid from the insurance company. So I am a broker, which means I really don't care what company you buy, whether it be Anthem, Aetna, Humana, Mutual of them, it doesn't matter because I'm licensed with all of them. We find out what's the best option for you. So that's pretty much how our program works. Now, one other thing that we do is we do assist you. Once you become a client, we assist you every single year at open enrollment. We send you an email. We send you, sometimes we send out like postcard mailings, things like that. This is, hey, open enrollment's coming because as you're probably aware, you see a TV commercial about every probably 5 seconds or 10 seconds of some insurance company trying to get your plan or get your business. What we do is we will reevaluate your plans and say either stay where you're at or we need to move you. So we will do that with you each year. We'll be your broker. We'll be there to help you to go between sorting out, should you stay with this current insurance company or should you move to another insurance company? So we do that for you. Well, I do want to thank everybody for taking the time to listen to the presentation. If you guys have any questions at all, I am more than happy to help in any way. Our office and team and staff are here to make your transition of going into the Medicare maze an easy process for you. So thank you so much.